Welcome to episode 205 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. This is part 3 in a 5-part series about poison myths and misconceptions. My guests are Angel Bivens and Dr. Wendy Stephan. They're both educators at poison centers. Angel is a pharmacist from Maryland, and Wendy is an epidemiologist from Florida. In this episode, we'll cover 5 topics. Which 5 topics? First up, myth or fact. Poisonings are always accidental. Second, do poison center staff stay in their own lane, or are they actually crime-fighting ninjas? Then third, we'll discuss misconceptions about pharmaceutical-grade prescription fentanyl. Fourth, we'll talk about opioid overdose and recovery. Fifth and finally, we end with myths about herbal, natural, and organic remedies. As with the other parts in this series, I need to share a brief disclaimer. Listener discretion is advised. Some of the topics we cover in this series include children putting weird things into their mouths, poisonings, injuries, and death. These are sensitive topics. If you have children, small children, or impressionable individuals listening with you today, listener discretion is advised. Thank you. We ended part 2 of this series with the question, are poisonings always accidental? Great question. Let's hear from Wendy first.
Well, no, really, because I would say the majority of calls that we hear about at the poison center are just accidental. And if you look at the fatality result, data as well for people who die from poisoning, the majority are also accidental. And I think that sometimes is surprising to people. So in terms of intentional poisonings, those tend to be self-harm. And we've seen increasing, cases of suicide over the years. And it was scary in recent data is that we saw, now in the 10 to 13 age category, suicide by poisoning is now in the top 10 causes. So suicide in children in general is super alarming. But, for poisoning, we're seeing it now, really in significant numbers, and again, preventable. So we absolutely consider intentional poisonings preventable, and it's a lot of the same tools we use for accidental poisonings, right? It's limiting access, getting things out of the home that don't need to be there, recognizing when someone is at risk, when you have someone in the home who's struggling with depression or going through a crisis. You wouldn't want a loaded gun in that home, right? And you also wouldn't want a whole medicine cabinet full of opioids in that home in that moment. So we've been putting actually a lot of effort recently, at our poison center certainly, but poison center educators in the country have been talking a lot more about including intentional, prevention of intentional poisonings in our outreach. And so things like securing medicine in the home, disposal, right? These have been topics that we've hit more consistently and sort of across the population.
So in addition to self-harm, illicit substance use. So again, we can help with those situations as well, especially the new and novel things that come out. Sometimes poison centers are on the forefront of knowing what's out there. And how it changes, right? The first time it comes out and the first time we hear about it, it could cause one set of symptoms and then it morphs into something completely different because you know what? There's just not good manufacturing processes for illicit substances of abuse. And what you think you're getting, you may not be getting. So again, we can help with those. We get occupational calls. So workplaces, dealing with chemicals or what have you. So again, not everything is accidental. It can be part of your work. It can be self-harm. It can be, trying to abuse things and use things in an inappropriate way.
Right. Like you talked about that computer spray earlier, a keyboard cleaner or whatever. Right. Somebody was probably huffing it and trying to get high. That's intentional.
Yeah, intentional use, but unintentional harm. Like people don't necessarily mean to be, keeling over with, fatally from these substances. They don't realize that potential is there. And that's where we can advise and help. And again, guide parents. We do get calls about people who believe they are being poisoned by others. that is, a call that comes in. And for those calls, we really generally refer, and Angel, back me up here, or contradict me if I'm wrong, we would generally refer that to the police, and then we could assist the police with that investigation. We are not able over the phone to do that type of investigation or testing. People often approach us like, we had a call actually or an email actually just this week at our poison center where someone was saying, my neighbor sprinkled powder on the grass at our condo and now my dog is sick. I want someone to come test the lawn. And so that's not a service poison centers provide. That would have to be done through law enforcement because there is a crime that has been potentially committed. So I, just wanted to sort of the limits of how we can assist for that type of intentional poisoning.
And yes, so you were absolutely accurate with that, Wendy. And to add on, they'll call us saying that I think I was poisoned. Here's my coffee. I want you to test it. Again, that is another situation outside of our ability. We do not have the ability to test anything here. We are a telephone advice hotline, right? So again, we would recommend that if you think that that's the case, you're going to have to get law enforcement and they will have to go ahead and use their labs, or you are more than welcome to open up the phone book, look for a phone number for labs in your area and pay to have it tested.
We are able to assist. So for instance, sometimes we get somebody calling and they say, I think I have been poisoned by mercury, or okay, so whatever. What we can do is we'll tell that caller, you need to consult with your physician, and we can walk your physician through the types of testing and the processes that would be used to detect mercury. So it might not be as straightforward as a blood test, right? There might be a 24-hour urine collection or something that your physician may or may not be familiar with. So that's more of an environmental health role, but we can provide assistance to the medical provider to help conduct the test and then interpret those results. That's the other thing. You get a physician, a family physician who's getting these results back. What are the thresholds? What does this mean? Poison centers can help with the interpretation of those results as well.
Right. So, but the key there is you need to involve. It's not us with the caller. We need to get that healthcare professional involved as well, and we can provide the guidance to the healthcare professional.
That definitely sounds like one of your more complicated calls that maybe needs to be escalated and the next tier up needs to deal with that. I can't imagine you deal with mercury poisoning every single day.
It's interesting. We've seen some cases not, recently, whether those are from sort of ethnic products or people have brought in from other countries in terms of skincare, particularly. We've seen, some skin lightening creams that actually have very high levels of mercury. So that's one that's sort of been on our radar recently. But also fish consumption, people who eat, and this is interesting because this affects higher income populations, people who are eating a ton of say, kingfish or swordfish can very quickly accumulate mercury, high levels of mercury as well. And so that is a dietary source. So yeah, these things we think of as being real exotic, but they turn up more than you think.
Yeah.
Well, thanks for sharing that. One other thing that I don't have much experience with, but when I was working in a community setting, every once in a while, I would get a call from somebody who needed a pill identified. And somebody would intentionally be taking these pills, of course, because they thought that was their medication. But in recent years, we've seen the advent of more counterfeit medications. Can you talk a little bit about that, where it's, intentional use, but accidental harm there?
Well, sure. That's been sort of the DEA has been, putting out the alert about these, the presence particularly of fentanyl in counterfeit pills, particularly counterfeit, Xanax, oxycodone, and some of these things that look like pharmaceuticals are being sold on the street with very, very convincing imprints and colors and dyes and shapes and all the things that we would visually use to identify a legitimate prescription. So in the past, poison control centers have, most poison control centers, I don't know if it's all, but our poison center certainly did pill IDs routinely for people. They would call in, they would say, I have a round pill, it's pink, this is its imprint. We would say, okay, this is what it is, this is what it's for. And, and if the call was coming, say, from law enforcement or a school nurse or something, we would be able to tell them, listen, that's a scheduled drug. It is, restricted by prescription or that type of thing, and provide that type of guidance. Now, if that pill is not in a pill bottle, it's in a little baggie and it came from wherever, we can tell the caller what it's purporting to be, but we are completely unable to say what is actually in that pill. Our DEA lab locally has been telling us that really almost everything that's being sold on the streets right now as a stimulant is in fact meth. Which is surprising to us because I think of meth as being like a rural problem that hasn't really affected cities, but in fact, we're definitely a city, and apparently it's just very cheap right now, and that's really what's driving that. And then they are telling me that fentanyl is showing up in things that are purporting to be, particularly Xanax and oxycodone locally, and I think that probably is different around the country, sort of the mix of what's turning up, Angel. I don't know what you're seeing in your community.
Yeah, it really depends on where you are and what substances are found. I think here we're seeing fentanyl and cocaine.
Yes, so again, that as well. Yeah.
So source is important here, right? If you're buying something on the street, the bottom line is you have to go by caveat emptor, let the buyer beware, right? Because there is no way to know what exactly it is that you are getting when you're buying something off the street.
Yeah. I heard this.
Go ahead.
No, I was just saying, I heard a drug control sort of promoter say, in the old days when we told you that you could take one pill and it would kill you, it was hyperbole. Now this is actually the case. Right. And I thought that was kind of a sad commentary that on, where we've come.
Well, since you brought up the F word, Wendy, fentanyl, let's talk a little bit more about fentanyl. When we were having our planning discussion, you talked about rainbow fentanyl. What is going on with that?
Well, yeah, there was a lot of talk about that sort of back heading toward Halloween. Particularly, there was quite a bit of media out there, sort of warning people about the presence of these brightly colored tablets that might be marketed to children. And I think the media kind of picked it up and ran with it in a way that really, actually, if you looked closely at the DEA warnings, it wasn't that these things were being marketed to children or trying to hurt your children. It was more just that they were out there, and for drug control agents to be familiar with the appearance of this as a potential trafficking issue. But yeah, the media sort of picked it up, spun it out, and it picked up a lot of steam as, the drug dealers are coming for your kids, which, we were kind of joking in our calls, sort of that, children do not have money. and so the idea that drug traffickers would be focusing on children at Halloween is kind of absurd. So we see this as a trafficking issue. They were dressing it up essentially as something colorful and candy-like so that they could move it without detection. So it's not, their aim is not to morally corrupt your children. It was really just to move these substances around without detection. So is there a risk to children? Of course, because it is a highly concentrated drug that might be in homes where people are using substances, might be confused for other medications, et cetera. So the risk is there, but I don't know, at our Poison Center, we didn't really jump on that in terms of promoting that to families. It was more of a risk for people who are using substances, and really fentanyl test strips are kind of the way to protect that population.
I agree. And I think that especially with your audience, we need to emphasize, right, that street fentanyl is, whenever we hear all of the media, and I think that there are billboards, beware of fentanyl, we want to make sure that pharmacists understand that the fentanyl that you are dispensing for, prescriptions that in patients in need, it's still perfectly safe to use as a prescribed pain medication. And it is really different than the fentanyl that's on the street. Okay. We actually have two different codes in the land of Poison Center. Prescription fentanyl, illicit fentanyl. We just treat them completely differently. The other myth out there surrounding fentanyl is that if it gets on your skin, you're going to be immediately symptomatic. And I think pharmacists can appreciate the fentanyl patch. How much fentanyl is in the patch versus how much is delivered into the body? Okay, so fentanyl doesn't immediately get absorbed through the skin. It's just not a good vehicle. So again, we want to make sure that we're educating properly.
Yeah, the sort of fentanyl kills message, has been alarming to me just because we've heard anecdotal stories again from our rotators who are, emergency medicine residents. They are on the front lines and treating patients with trauma and all sorts of serious injuries. And they are telling us that people are refusing to take fentanyl for fears of dying. So, in a medical setting with a medical healthcare provider giving a measured, safe dose under supervision, they're still afraid. And we know that fentanyl, of course, is a very effective, medication when used appropriately. So that's concerning. We don't want this really great tool to be lost from our toolbox because of the dangers of street fentanyl, which is, again, totally different ballgame.
Fentanyl is something that is very polarizing right now. I mean, it's something that everybody's either, for because they've been sick and, been anesthetized for some sort of a surgery, emergency, maybe a C-section. So they're for it, of course. The people who have experienced medical fentanyl given by an anesthesiologist are for it. But then there's these people who have never experienced fentanyl and never needed it, never been in that situation where they've needed surgery or emergency care. And they just hear about these things. They see things on billboards and they're just like, oh, fentanyl kills. Just like you said, Wendy, that message that is out there. And because of that, they are polarized the other way. They're completely against it. Do either of you want to comment on that at all?
I think when we're talking to, say, teens and we're in the drug prevention space or we really want to protect people from harm, from substance use, when we have these sort of over the top, fentanyl is deadly, it's killing everyone and everything, these messages, it belies the fact that it's being sold and used on the street every day. Like everyone who uses even street fentanyl is not dying. And the fact is that people are seeking it out. So we've heard, anecdotal stories from our needle exchange program here, which is just down the street, which is an amazing life-saving program. But they say when there's a fatality in the community from fentanyl, other users, active heroin, opioid users in the throes of addiction, they will ask, where did they get that? Because that's obviously the good stuff because it's really strong. So people who have an addiction, this is a progressive disease. They need more and more concentration, higher and higher doses to maintain that, that feeling of normalcy, not necessarily to get a high, but to avoid withdrawal. So there is a demand for this extremely powerful, dangerous drug because of people who are experiencing active addictions. So the idea that somehow it's out there and it's just deadly and the drug dealers just want to kill you is not the whole story. I think we need to be more transparent about what addiction is and this population that is in this trap where they are forced essentially by the lack of treatment available, their lack of access to services and support to continue seeking these really dangerous situations and they're dying. So it gets back to the issue of stigma, I think.
And, at the same time, stressing that when used appropriately, prescribed by a physician for a short term, it is an absolutely perfectly acceptable medication. So again, that's where physicians and pharmacists can help, allay those fears that what your doctor is prescribing you, he's not immediately getting you addicted. He's not immediately poisoning you. It's different. This is just like other medications. So again, trying to separate the street messages for the addicted community versus patients in need of a painkiller.
And Angel, you bring up such a good point, sort of the importance of the prescriber and the dispenser asking. Like, again, we don't want to create put people at risk who maybe are in recovery, right? And I talk to people in the community all the time, and they say, I'm in recovery. I've been, clean or sober for X number of years. That person is carefully guarding their recovery, but they say every time I go to the dentist, every time I go to the doctor, they're inadvertently putting me at risk for a relapse. And so I think it is a fair question to ask your provider, your prescriber, is this a potentially addictive medication? Are there alternatives for me that do not have that potential? And or just disclosing your history. Like, listen, I struggled with addiction for years. I don't want to go down that road. Then that's a person who really might want to avoid fentanyl for perfectly legitimate reasons. And that's a conversation to have with your provider.
Absolutely. So we do recommend folks that, have your medicine list, right? And talk to your doctor so that you're not doubling up. So when they prescribe something, you can say, here's the list of all the medicines I take. But in addition to being honest with them with regard to that, yes, Wendy, you have to go ahead and say, oh, and by the way, I am in recovery. So we need to have that as part of my medical history also. So you don't unintentionally prescribe something that's going to set me back.
And I think we really have a misunderstanding about like how common recovery is like that. And I saw a number the other day. It was something like 25 million Americans are currently living in recovery. So this is not like something that is totally rare, totally marginal. There's a really good chance that the person standing in front of you at the counter or sitting in your exam room is either actively using drugs or is in recovery. So it is absolutely a conversation that should be had.
Great points. Thank you for mentioning that, Wendy. Talking about relapse, recovery, substance use disorder, all those things publicly, it can't be done enough, I feel like, because like you said, there's more people struggling with it than we know about. I'll tell you what, I did some volunteer work for my county's addiction task force, and I organized some faith community discussions about opioid addiction at my church. You would not believe how many people at my church came out and said they were affected by addiction disorders. Not necessarily they themselves, but a child of theirs, a grandchild, grandparents raising grandchildren because of addiction disorders. People, I don't want to out anybody, so I should stop there. But there are people in your life who are affected by substance use disorders. And unless we talk about it, it's never going to be normal to talk about it.
And that influences access to Narcan, access to medication-assisted therapies, all of these things that we know have good evidence save lives. So as pharmacists, you're in a position to be asking these questions, to be promoting the availability of these life-saving therapies. So yeah, we couldn't support that, more.
Well, thank you. This has been a great discussion about the F word, fentanyl, but let's move on to our next myth or misconception, shall we?
Let's do it.
The next myth is that herbal, natural, and organic remedies are completely safe and non-toxic.
Oh, I'll jump on that right away, because when people say natural substances are non-toxic, I will immediately say cyanide is natural.
Arsenic, natural. Lead, natural. Cadmium.
Okay. All of the above natural. Would any of you like to have a big old helping of arsenic or cyanide? No.
And there's also not definitions, when you're buying a product that is labeled, organic may have actually a standard depending on the labeling, but natural, there's really no standard. And just because a product is something that you eat in food, so for instance, garlic, we talked about, garlic tablets is not the same as the garlic that you consume in, pasta sauce, that it's a matter of concentration because you're taking it in that setting for a medical purpose. So someone was explaining to me that a garlic tablet has up to 40 cloves of garlic concentrated in it. And so not surprisingly, you can see much greater effects. You're taking it for a medical reason. So personal story, I was told that my blood pressure was getting a little high, a little stressed. So I thought I'll solve this problem. Garlic tablets. And 2 weeks later, I didn't connect the fact that I started having esophagitis, real pain. And I went to my doctor. He prescribed like the most boring, bland diet you've ever heard because he assumed it was diet related. I didn't disclose to him that I was taking garlic tablets because it wasn't on my radar, because it was natural. So it took me quite some time to figure out that I was having this irritation as the result of this incredibly potent supplement that I was taking causing a side effect. And so I think people sometimes underestimate that potential with products they consider foods or natural, herbs, et cetera.
So the hallmark statement for all poison center people is that it's not the substance that makes the poison, it's the dose. Okay, so anything can become a poison if taken in a sufficient quantity. Number one. Number two, natural just means that it wasn't man-made, right? It doesn't necessarily mean that it was meant to be taken into the body. So natural cleaners just mean that they're derived from, non-man-made substances, but it doesn't mean that that substance is supposed to be taken into the body.
Like essential oils, right? There's
Exactly.
during COVID, we saw the growth of a lot of essential oils being marketed for all sorts of purposes, even for curative purposes. And some of those were being marketed to take internally. It wasn't just a scents or, or even external use. They were talking about orally and being marketed for some pretty outrageous purposes, in my opinion. I've heard them. I was at a table next to a vendor, and they were talking about arthritis and all sorts of, things that people struggle with, right, to get help. And they were kind of, in my opinion, preying on some of that difficulty by marketing some of these natural products. And there are potential harms. So a lot of essential oils are not the correct grade for internal consumption, and may have contaminants depending on how they're marketing, and then are inherently irritating. Right? So particularly eucalyptus and some of these other cinnamon, those are the ones that jump to mind. Those appear in our toxicology textbooks. So there's a whole section on essential oils.
And if parents are of the belief and buy into the myth that natural products are safe, they may not be storing these products, up away out of sight, and small children are going to get into them. So again, natural does not necessarily mean safe or non-toxic.
And there may be drug interaction issues that the patient isn't considering. And so that's a really important thing to be asking. One of those great reasons to be disclosing all of the herbal supplements and natural products that you're taking to your pharmacist, and for pharmacists to be asking. Here in South Florida, it is really common that people bring home, different remedies from Cuba and other areas, Haiti, et cetera, that have been used traditionally by family members and loved ones, and they may or may not play nicely with prescriptions that person is taking. So we've seen some examples of that. So one that was given locally was someone was taking anise tea, so anise seed tea, but they had combined it with some sort of sedative in the hospital, and it was having an exaggerated effect. And no one even knew they were taking it. The mom had brought it into the hospital. She had brought the tea bags into the hospital unbeknownst, and when they moved the patient, the box fell out of her belongings, and that was what solved the problem of what was going on with that patient. So keep your eyes open for teas and remedies, and certainly be asking, because I think we really have to see the whole picture. And I saw recently with older adults, it's something like 60% of older adults are taking either supplements or herbals or tinctures and may or may not be disclosing them.
All of our older adult medicine safety education, we hammer home. Not only are you listing the prescription medicines you're taking, but the over-the-counter medicines you're taking and the herbals and natural supplements that you're taking, because they all play in, they can all interact, and you just have to do full disclosure. So Wendy, I think I'm going to take a page out of what you were just saying and include teas and things like that as well.
Yeah. You think of tea as being so harmless, but my daughter for a while my youngest went through a period of wanting to drink licorice tea, like every day, like just loved it. And I actually looked it up and I was like, there is a point at which this could cause a problem for you. So we need to like step back. I'm glad you like the taste. And so she moderated her consumption somewhat. But how many people would know to do that research, to know that something sold in the grocery store in the tea section could have a medical impact? And it's just remarkable to me how often it is that people do consume huge amounts of something they like to the point where it can endanger them.
These are all good points for anybody listening. We are not trying to deter patients or you yourself as a listener from using herbal, natural, and organic remedies. We just want you to take it with a grain of salt that they may not be completely safe and or non-toxic, right? Anything else to add, girls?
Just in terms of, when you're making these purchases, do some research about that they actually contain what they are purporting to contain. That's one of the other issues is that people say, well, I tried this thing and it didn't work. Well, it might not have had the same concentration of that ingredient as the research that supported its use. And so always just trying to look a little bit into the research. One great resource for that is the NCAM, which is the National Center for Complementary and Alternative Medicine at which is one of the National Institutes of Health. They have really nice summaries for patients and for providers on all sorts of different herbal topics and alternative medicine practices. So I go to that fairly regularly to see if there is support for something and to see particularly if there are toxicology warnings.
And knowing your source, right? You don't want to, buy something from a non-reputable company, right? Some are going to be more forthcoming or more in tune to testing and making sure that what they put on the label is in the product. Not everybody is going to be like that. So just, again, know your source.
And the FDA really is not much help in this regard, unfortunately, because there is no testing required as to safety or effectiveness for herbal products. And I think as a consumer, a lot of people don't understand that. Certainly adverse events are reported to FDA and then they may take action after the fact, but there is no pre-market restriction. And I think, again, people are always surprised when I bring that up in my trainings.
Yeah, I believe you're referring to the 1994 Dietary Supplement Health and Education
Indeed.
Act, DSHEA.
Yep,
yeah. Oh, touché. That's cool. Back when I learned about that in pharmacy school, I was just surprised that there was no, I guess you would say, oversight. Nobody's really checking in to make sure that what is on the label is actually there. Although, isn't there something, I'm trying to think of the designation where it's, is it... I think that there is some designation like NF. I'll have to look into this, but if it says NF on it, it means that National Formulary, I think is what it stands for. What is purported on the label to be in there is actually in there. Again, do your research. I love that you guys brought that up. Whatever you're taking, do your research. As we were doing our planning meeting, we were talking about tea that comes from certain sources may have lead in it. Would any of you like to talk about that?
So, the use of traditional medicine has grown over the years. And certainly in our family, we've tried it. My husband took some teas for his asthma. He found it useful, et cetera. So we know there's a ton of different approaches to health from around the world. But again, there is concern. We have seen certain cases where these herbs were grown was in contaminated soil, for instance. So there were a few cases in California where, some of these herbal remedies and teas actually did have high concentrations of lead because, if it's grown in an urban environment, in an industrial area, et cetera, again, no testing that happens before a product is marketed. And so we're essentially exposed to these unknowingly. So just good to keep, that in mind if you're going to try these products and you develop some symptoms, make sure your physician is familiar with what you're trying. And, if you're worried about contamination or particularly heavy metals, how would we test for them, et cetera. It's good to know.
All right. And one last thing, when it comes to herbal, natural, and organic remedies, I know medical cannabis is something that's become more popular. That is something that could harm a young one. And I believe Angel actually talked about that a little earlier. That is something to look out for. So make sure those products are out of sight and out of reach of young people.
Yeah, particularly the gummies, we've noticed that really, while we have seen brownies and other baked goods and oils and butters and et cetera, and plant material, of course, in homes for quite a while, the gummies are rising to the top in terms of hazards for children.
And when you read these packages, it'll say serving size for that THC content is 1 to 2 gummies. What child do you know that sees a package of gummies and stops at 1 to 2? For that matter,
Good
what
point.
adult?
I can eat a whole bag. Those ones that says party pack at the airport, I eat it on my flight. It's
exactly. So
horrifying.
again, you read the label. Cannot stress enough with stuff like that. Read the label. There was a bag of Dorito-looking chips with THC. And honestly, I think that you could, for the amount that was a normal dose, was 1 chip. Who eats 1 Dorito chip out of a bag?
Yeah, as we're seeing more food products and drinks with THC and CBD. And I think we still face some pushback when we do education on this, like you need to be cautious, be aware, people get really outraged. They don't believe it's possible, but we are seeing these cases. We continue to see these cases at poison control centers where people have multiple symptoms, including serious symptoms, and not only children. Certainly children are seeing the most extreme, but even adults can try this stuff, and if you're naive to it, it can be a really unpleasant experience. And some of the symptoms that we've heard, is sort of paranoia, even hallucinations in some cases. People have unpleasant experiences, so that is possible. Also, hyperemesis syndrome. When we've tried to educate on this cannabis-associated hyperemesis syndrome, again, we get an avalanche of people being very angry that it doesn't exist, it's not possible, but we are seeing these cases over and over in the ED. These are people who believe they have a flu, they are vomiting, they are sick and sick and sick. They keep showing up in the ED, and the telltale sign is that the thing that helps their symptoms is a hot shower. If any of your listeners, or patients they're interacting with mention that what helps is a hot shower, then chances are that what they're experiencing is hyperemesis syndrome, which is this, unusual reaction to heavy daily marijuana use that seems to trigger what looks like a sensitivity of some sort. And really, the only thing that helps, in terms of a cure, would be discontinuing use. And I saw one study that said it was taking on average 7 visits to the ED before people did in fact discontinue. Because these are people who have developed, a very, robust THC consumption pattern. And, maybe they're using it to treat pain, anxiety, sleep, et cetera. And you're telling them they have to stop. That is not a welcome message. So just keep that on your radar. Our colleagues in the EDs are seeing these cases around the country.
And a shameless plug, I believe one of our healthcare professional newsletters, Talks Tidbits, is we have an issue on the hyperemesis syndrome.
Sounds really
so
unpleasant.
if pharmacists want more information, they can certainly search our website for that, the Maryland Poison Center's website.
I will definitely put a link to the Maryland Poison Center's website in the show notes.
Excellent.
All right, let's move on to one of the last myths and misconceptions. Let's talk about Hollywood. In movies and on TV, timelines get distorted. How can that affect poisonings? That's a good place to stop. Part 4 in this series will start with a discussion about how movies and TV shows affect our perception about poisonings. Thank you for listening to part 3 of my poison, myths, and misconceptions discussion with poison educators Angel Bivens and Dr. Wendy Stephan. This is in honor of Poison Prevention Awareness Month here in March 2023. Please visit thepharmacistvoice.com to read the show notes. In the show notes for this episode and all episodes in this series, you'll find the Poison Helpline phone number, which is 1-800-222-1222, links to resources and websites mentioned, social media links, and much more. I'll wrap it up here so you can move on to part 4. Thanks for listening to part 3. Enjoy the series. Wendy, this is the bonus myth. let's talk about the cost of using the poison helpline. What's the cost?
All right, so it's always free. There's been some misinformation out there that we really want to counter. I think it came from TikTok. My daughter, who was a TikTok user, shared this with me. Basically saying that, poison control is now charging, you have to pay. And it really stemmed from a misunderstanding where a caller had been referred out for a complex veterinary consult. They had been calling our services for a dog. And the people on the phones, as you know, are doctors, nurses, and pharmacists, not veterinarians. There are wonderful services out there that do charge up front for veterinary exposure. So we do frequently refer folks out for those services. But it is true you have to pay for those. But you never have to pay for our services, and we don't want people to hesitate to call when they need help.
Awesome. Free. You can't beat that.
Yeah.
Absolutely. And the number one more time?
It's 1-800-222-1222.
Thanks, Wendy.